My name is Michael. I'm the clinical teaching fellow specifically for ENT. But over the last year, since August of 2020, I had the pleasure of being a teaching fellow here and actually designed a revision lecture series for final year medical students. And I appropriately named it ENT Crash Course because for some people it felt like a crash course and something that they really needed to do. And I think for the last 12 months, I think, we've all had our shares of difficulties working in the NHS. But I think that is not to say that the students just stayed at home for 6 to 9 months. I think a lot of their students actually took up on other roles that really supplemented their learning. So, we've got Daniel Last on the left-hand corner. He was working as a student paramedic volunteer even throughout Christmas. And we've got some photos of all the other medical students and nursing students around the country helping as a clinical support worker. What that unfortunately meant was I think a lot of our clinical students, especially students in their CP3 year, were then having to revise for CP2 and CP3 content, but lacking sort of the clinical link, going on the ward, seeing unwell patients, or even hanging out with the junior doctors. And instead, a lot of their learning were sort of redirected to the online learning that they were tasked to do in the form of Moodle, which really sort of further highlights some of the things that we knew about before the COVID pandemic, which was that more than 50% or more than half of our medical students, colleagues, suffer from stress and burnout and anxiety. And I think it is safe to say that a lot of our CP3 students had their fair share of those, but also whoever had pre-existing conditions really felt their mental health sort of deteriorate. Which really begged me the question when I started my job. I was not too long ago, maybe 2-3 years ago, a final year medical student, really breaking it. So I thought, what can I do for these students? Because I couldn't really fathom myself being in their shoes. And I thought that the best thing I could do was to ask them what they really wanted from their CP3 year. What can I do for them remotely? And I think there were two major thematic concerns that I found from speaking to the students, which were amongst all of their exams, they're most worried about MCQs and OSCEs. And I decided to focus more on the MCQs. And how I went about doing this was design the ENT crash course, which was a weekly session, one Wednesday afternoon for about 2 hours, where I'll cover some of the subspecialties in ENT, such as otology, rhinology, pediatric ENT, and also head and neck surgery. And I've ran the session in 2 cycles from the November of 2020 to February of 2021. I used PowerPoint because it's the easiest thing to use, but also to get more of a response from the students, I used the audience response system, or ARS, specifically Mentimeter. And I think this really had its place in medical education, and especially in online distance learning, when students aren't so keen to have their cameras on perhaps, or have their microphones on, and I could really get a real-time interaction with the students there. So I'll give you a brief sort of summary of what I've done. So here's an example. So case study number 1, 25-year-old female presenting to the GP with notable asymmetry of the face, who is otherwise fit and well with no other comorbidities. And I would ask them a question like this, which they would then answer on Mentimeter. For example, answering this question here. And then the follow-up questions would be questions that they might get on the exam. So for example, what is the most likely investigation to yield in the diagnosis? And I've highlighted the important words there to help the students. And this was more of an open text question, such as asking the difference between cytology and histology. And I've given them also tips as well. So, for example, the questions can be very long. And for a person like me who hates reading, this can be a very challenging thing. But focusing on the important points within the STEM is the most important thing to do when you're answering the MCQ questions. And that's what I try to instill in the students. And after each session, I've sent out a questionnaire using the Likert scale. 1 is strongly disagree to some of the questions, and 5 is strongly agree. And the questions focused on whether they found the sessions useful, what could we do to improve, and I also had an open text question for them to give us feedback. Now, in terms of the results, I'm not going to bore you guys with the statistics. I think majority of the participants felt the sessions were well organized and they were relevant to revision. And there were no statistical differences between the first and the second cycle, which was quite interesting because although I made some changes to it, it didn't feel like there were a lot of differences from the students' perception on how the sessions were run. And I think what I find the most useful when I deliver these teachings, because I think a lot of students just spam with 4 and 5s, is to actually look at the open text. And I was really reassured by some of the comments that I was getting, such as saying that this was pitched at the right level, the quality was excellent, they were actually looking forward to the next session, which is always encouraging. And I was using language that was easy to understand, and I had an appropriate pace to my sessions. That is not to say that all of the comments are positive, but if you were to sort of combine all of the comments onto a word cloud, because I'm quite a visual person, you can see that a lot of the students felt that it was clear in explanation. There are a lot of case studies, good breakdown, and I'm glad to say that some people found me actually funny. I think some of the criticisms that I got was that a lot of the students were quite stressed about the CP3 and CP2 learning objectives and outcomes. And I think the students found some of my questions easy. And I think, to be honest with you, I was looking through the objectives, and if they found my questions easy, I think they were quite on the right track for the exam. I think a lot of students found that the sessions were longer, and I think that's because as a teaching fellow, I have some biases on what I think is important for the students to know. And I think that made me realize that I need to focus on what the students need to know by looking through their learning objectives. And that also helped me considerably cut down on the time, where my first session was about 3 hours long, and it was hard for me, it was hard for the students. But eventually, as the sessions went on, I cut it down to 1.5 hours and made sure to give them a break in between, because that was another criticism that I got. So I think the take-home point from my side was that overall, this was a positive learning experience for the students and also for myself. I really enjoyed doing these sessions. And it was an effective learning strategy and a revision strategy for students who are perhaps a bit apprehensive about learning about ENT, because it can be a challenging topic to learn. And what I realized at the end was that this should be, or any revision courses should be directed for the students, so shorter length, giving them an ample amount of breaks, and also giving them clear communication and ahead of time if this was going to be a longer session was essential. And as a final point, I personally think that as an educator, you do need to focus on your students and focus on the priorities of making sure that they're well supported. And anything that I could do to support my students, I was going to do this year, especially with the COVID-19 pandemic. And I think going forward, I'm hoping that my successor to this post will continue on with this program. Thank you very much.